Welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. We always hope you gain something from the program that'll help you and your loved ones. Our topic today is pain. Not just pain, but the alleviation of pain as well, or managing pain, I suppose, is probably a better topic. We have Dr. Kumar, thank you for being here.
Thank you.
And Monica, thank you for being here as well. And you've been on previously, and we were just talking before the camera started rolling about sometimes we don't really realize what kind of things are out there in the healthcare world until a diagnosis happens or something happens and we need it. So when we talk about pain, I guess talk about the difference between acute pain, like I broke my leg and I'm in pain, versus chronic pain. What's the difference?
Right. The basic difference is acute pain, you have an incident that happens, and then we're looking for the body's natural recovery time period. Generally, we anticipate that recovery time to be somewhere around a week, week and a half. If things start going a little bit further than that, then we always have to look at something underlying that may be going wrong. So whether we do physical therapy, whether we do massotherapy, etc., then that comes into play. If it still stays and continues not to improve and or getting worse and affecting the quality of life, then that's where chronic pain comes in. Our job becomes not to mask the pain, because masking the pain on the initial aspect is good, because we don't need our body to be stressed to that level. But as we all know, we need to be able to have the body get back to a normal. Yeah. So if the body doesn't do it, our task becomes to find the cause of it, the etiology, the reason for it, and see if we can trip something that can get your body to start healing again.
Gotcha. So it's kind of a time thing to define chronic pain. Depending on, if you had a major surgery or a small injury, there's a certain standard amount of time that you might think the body would be healed and you're free or don't have as much pain anymore. But if it's hanging around longer,
yeah, and generally we look at that 2.5 month.
Okay.
2.5 month period.
Okay.
And because you have to have patience, the patient has to have patience for the initial time period, because that is the reparative process.
Your body's working on stuff.
Yes, and it's got its minions going at it.
Right.
And so you just have to be patient and then follow through on the directions.
Okay.
And then we look from there.
What are some of the conditions that you see that people have that cause chronic pain that would have them come to you?
I think most of the patients we see are people with just arthralgias of the back, arthritis of the back. Okay. Whether it's due to an injury, and we have some with sports injury from high school, etc. But we also have our elderly population and or aging population where time basically chronologically affects our body. And if we have ignored it and or we've just grinned and bared it and gone through it, not given it the proper time and or tripped the correct sites, it starts picking up speed. As we all get older, we can see us decreasing in height. And that is a matter of, well, what have we done to slow that process down? Next, what have we done to be able to say, how can I improve what I have to go through on a daily basis? And both of them are interlinked.
Gotcha.
So the arthralgias, the arthritis, especially of the spine, is where we see a lot of the patient in our community here.
Gotcha. I can vouch for that. So that's the major one. Are there other, pain from, I'm thinking like diabetes, all that kind of stuff?
Absolutely. I mean, if there's a pain occurring, we deal everything from migraines to shoulder pain, neck pain, back, thoracic pain, and even low back and buttock leg pain. So we literally go from, top to bottom. There are people who have amputated legs who still feel their foot. So that's the phantom pain. Okay. So if that is occurring, our job becomes to define the problem and then be able to touch the problem and then be able to treat the problem. And touching the problem means that the patient has to feel like, yep, that was it.
Gotcha.
So it's a check, double check.
And do you find people have different pain tolerances? So pain for one person, the other person would be like, I wish my pain was that pain. I would, you know.
Right. And the thing on there, and I think part of that process becomes where pain in the past has been used as a sign of weakness. So it's how one perceives oneself, and yeah, well, no, I can tough through it. Well, the thing on there is you're not listening to your body's idiot signal. You know, it's the light is going on, ding, 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 put some oil in the car, and then we would wonder why the car all of a sudden on the side of the highway stopped running. Well, we ignored the signs and symptoms. Gotcha. So I think that the more we listen to the body, then all of a sudden people get empowered to realize it is not a sign of weakness or anything like that. And I don't have to ring the alarm on everything and seem hypochondriacal, nor do I have to just tough it and bear through it. Because all we need to do is, well, what the problem is. And we look at that problem, look to attend to it, and then educate, and then tell the patient, well, these are the things you can do to help mitigate or improve yourself in the future, so you can do your own body's preventative maintenance.
Gotcha.
You know?
Yeah.
As a hospital, as a facility, we're here to help anybody through any part of the journey. And it's not to say, well, you need to buck it up. Well, no, where the hell is it coming from? And what can I do to improve that? Yeah. And the same thing, you know, you don't have to, because all of those things then impact our endocrine system, which then impacts how fatigued are we, our energy level, our shortness, our quickness. You know, if one is not feeling well and somebody comes and asks you a question, or a child comes and asks you a question, you'll snap at an answer. Right. As opposed to, you know, just, it's okay. Right. That's the answer. Because you're just, I'm in pain, I'm in pain, I'm in pain, I'm in pain. And it takes a toll on you. It takes a toll on you. So it'll take the toll on the family, it'll take the toll on the spouse, it'll take the toll on the friends. And people then ends up becoming more isolated because they don't want to be around people, but people don't want to be around them. Right. So it becomes really a downward spiral. Yeah. So we like to incorporate a lot of preventative medicine, nutrition medicine. Yes. You know. We use a variety of vitamins, you know, multivitamins, calcium, like all of that, you know, builds, and that really helps strengthen the bones, the muscles, you know, things that are around where the problematic area. Gotcha. And then we also do just simple things like the putting Vicks. Yes, we use. I've heard of this. Yes, just plain old-fashioned Vicks. Wrap a towel, go to bed. It works wonders. It really does on the achy muscles and joints. So there's all kinds of things that aren't, you know, a big fancy procedure or anything like that. There's a lot of things that you can kind of coach people through. Let's try this, let's try this, let's try this kind of thing. The thing on there is, having done this for now 30 plus years, I think, you know, it's usually just, it's the same thing as your favorite recipe. You know, you've got it down. And so rather than having everything stretch out over time, it's pure physiology, it's pure anatomy, it's pure neurology combined together that affect the endocrinology, which then affects the person's psychiatrically, you know, because of stress, because that's how the body runs. So frequently what we see is, once we improve the person's pain, especially people who've had chronic pain for years, their blood pressure improves. The borderline diabetics or the diabetic now all of a sudden is not as diabetic because of the fact that the adrenal glands aren't squeezing as much and the cortisol effects have come down. It's all connected. Exactly. It's really connected. So if somebody wanted to, if they're hearing this or somebody's telling them about this and they're like, you know, I've had pain and it's just not getting better and whatever I'm doing, do they need a referral? Can they just call and you can work them through that? Well, we used to require a referral, but we don't any longer. So they can be kind of a self-referral? Yes, but we do request, you know, previous records. We do reach out to the primary care and, you know, try to get
imaging disc, like that's really important for us to look at.
Okay.
So we do take referral, self-referral as well.
Okay. And you're one of the spokes on the wheel of the hub of the patient. So you work with a primary care provider, I heard you say that.
Right, because I think that has to be the conductor. That
Gotcha.
has to be
Yeah.
the conductor so that they are aware of what is happening in the community and what there may be other trends. So there has to be, it's not one person go it alone.
Gotcha,
We are blessed in this community having all of those components.
Yeah.
And that can help us even optimize the patient better for themselves.
Gotcha.
So it may be, okay, this part of it I'm done, and now you need to follow up, and when you do your annual physical or the labs, etc., be aware of this. So that we can communicate that to their family physician, okay,
Gotcha.
the conductor of the orchestra.
Conductor, yeah.
And God willing, you don't need the cymbals or the drums anymore, which would be us.
Right.
Okay.
Very cool. So what are some of the, when I think of pain, luckily I've, anything that ibuprofen or Tylenol can usually take care of it, a heating bed maybe or something like that. But what are some of the advances? Because I know they're pretty cool stuff.
Yeah, I mean, the current state of the art is basically micro-interventional. And basically, we're just talking about needles.
Okay.
We're just placing the needles, but placing it at the right spot. And how we explain it to some of the patients is basically, I'm just going to hit the correct places and put some WD-40 on there. And if I can improve your pain, that means I think it's coming from here. Where did you feel it from? So we do this underneath the X-ray machine at the hospital because it's pinpoint, it's exact, it's accurate, and it's reproducible. So if we can do a double check on 2 times, we can actually come in with a needle again and cauterize the nerve that may be getting affected.
Okay.
So it is basically sacrificing one branch that may be caught in the electrical wires to save the tree.
Okay.
So we would just snip that branch off. And basically, it's a 15-minute procedure. The patient goes home, no restrictions, no nothing, and they can continue. If you were to have the same thing done in the 1960s, it would have been 3-4 hour procedure, and you were in the hospital for X amount of time. So science, technology, the resolutions of the X-rays have improved a lot. And then there are other procedures for different problems that we can attend to. But everything we do is outpatient. You come in, you have the procedure, you go home, you resume yourself to activity level.
Gotcha. That's pretty cool.
And basically, our goal is to empower total autonomy to the patient as soon as possible, and then make room so that the next patient who may need help can come into the bay.
And I mean, that's the goal. As I was saying before about the different pain tolerances, it's kind of, I would assume that the patient's probably the driver, like, okay, all I want to be able to do is reach in my dryer and my washer and get my clothes out, and I can't do that. So it's kind of, are they kind of telling you, I don't need to be running a marathon. I just need to be able to lift my grandkids up or whatever.
And the thing on there is, most of the time, in just giving that history, they've also given, the anatomy, what is the movement, what muscle deficit might there be, and then, so we can trace it just because all we do is look at blueprints all day. So we can trace that. It's like, okay, yep, got it here. This is where your problem, and we can just translocate it in a 3-dimensional manner to say, I'll wager you 98% chance here, less than 1% here, and da. And so with that degree of accuracy, we can move forward.
So improving quality of life and taking care of pain.
Right, but the thing on there is that by just that person complaining of that, but they were very stoic, because they were the caregiver, they had to be there. What you can do is, just by seeing that kind of will give you a window to the person's body. And then you would go, okay, you need to be, you need to focus in on multivitamins. Oh, but I don't like it. You know what? It doesn't really matter. You need to take the thing because your body needs it for its own preventative maintenance.
Yeah.
So we educate them, and with that education, hopefully they can not only practice it for themselves, but they can share it with family, with friends.
Right.
And then as a community, we can all lead a better quality and a better, healthier life, because we start understanding and getting educated about how the body works and what is a warning, what is not a warning.
Because I've heard people say, I had pain in my leg, and so we think it's leg pain, but you're like, no, actually, it actually comes up to your neck or what, you know what I mean, that kind of stuff. So getting that information from the patient, like you said, you're giving me a lot of information about, now I'm able to narrow it down, and now I can narrow it down even further. That's pretty cool.
Yeah, and then we can just say, okay, how's the whole car running?
Right.
Because the one ball joint may be the problem,
Right.
but that kind of tells you.
Yeah.
But you got to make sure the other ball joints are all okay.
Yeah.
So the joints of the car, so and a car analogy is a very simple analogy people can understand,
Yeah.
and they don't take it personal at that point,
Right.
because it's not, well, what are you talking about me?
Right.
No, it's just the same as any your house,
I do have a question. We have just a couple minutes before we wrap up, but pain medication, opioid, all that kind of stuff. We've swung pendulums back and forth. What's kind of the current, if a person needs a controlled substance, I don't even know if I'm using the right terminology,
No,
but
you are.
yeah, I mean, that's okay.
Well, the thing on there is, if we start talking about the windows of where we need it, but if we are saying that is going to be the part of my life for the rest of the life, well, do we know why that is going to be the part of the life? And are there any other solutions?
Gotcha.
So, again, we expect the body to heal in a particular manner. If it doesn't, that is the body saying there is something else underlying that is the problem. So opiates are a great tool, to have in the tool chest. But every time something happens, we can't always say, well, give me the sledgehammer.
Yep.
We can finesse it. We can finesse it. And that will change the person's quality of life. Because there are some patients that we've received where they can't remember the last 5 years or 10 years of their life because they've been in basically a stupor. They functioned, but they didn't live. They were almost like automatons.
Yeah.
And that is sad when you talk about, the children or the, grandchildren or the, etc.
There's a better way.
Well, there has to be a better way.
Yeah.
And the person needs to, there is self-responsibility there. Because if it is not working, seek and talk to the physician and say, okay, this is not working. Why is it not working?
Yeah.
It's not a sign of weakness on any one person's part. It is more of, well, but I want to get to the root cause.
Right.
And if we can get to the root cause, we can generally attend to it better.
Make a big difference. Awesome.
Yeah.
Thank you, guys.
Thank you very much for having us.
All right.
All right.
Thank you. Again, pain impacts so many people in so many different ways, and it really impacts quality of life, and that's what we really need to help improve. So I hope you've learned something. Again, share the resources with yourself, your neighbors, your friends, if you know somebody it could benefit. If you ever have an idea for an episode, you can reach me at the hospital or Mrs. Pels here at the high school. We're so glad you've been here, and until we meet again, I encourage you to make time for health.